HIV/AIDS is still around, and so are drugs and alcohol. Unfortunately, they're popular, and they're also unnecessary, so there's a way to deal with them, and to keep yourself safe, and to identify ways to help yourself if you've been infected, or you're dealing with drugs and alcohol. Now, what do drugs and alcohol have to do with HIV? What do they have to do with AIDS? Well, drug and alcohol use can lead to risky behavior that can make possible exposure to HIV/AIDS that might not have happened if the drugs and alcohol weren't there. For example, using or sharing needles or other drug materials. Those are pretty serious, right? Like or you're using other drug materials like rinse water or cotton, increases your chance of becoming infected with HIV. Just because you can't see it or it looks clean doesn't mean that it is. What if I already have HIV? Here's a question. There are different types of HIV called strains, and even if you already have one strain, using drugs puts you at risk for being infected with a different one. If you are pregnant, you could even infect your unborn baby. Now, what if you're in that position where you can't stop using drugs or alcohol? You're just addicted to drugs, or you're an alcoholic, you can't stop drinking. Don't be afraid to ask for help. Do not be ashamed to ask for help. Don't be embarrassed to ask for help. Go ask for help, and you're going to get it. Call the Substance Abuse and Mental Health Services Administration's National Hotline. That's at 1-800-662-HELP. 1-800-662-4357. 800-662-4357 for help in getting treatment right now. It can be your first step towards recovery and a better life for yourself and everybody in your life. If you decide to get drug or alcohol treatment in addition to HIV treatment, let your current doctor know. He or she can work with your drug or alcohol treatment provider to make sure the two types of treatment work together and are more effective for you to get better. Did you know that drug abuse behavior right now plays the single largest role in the spread of AIDS, HIV infection in the United States today, right this minute? Drug abuse behavior is doing it. Half of all new HIV infections now occur among injection drug users. The question here is, what if I can't handle all of this alone? Look, he's worried. What if I can't do it by myself? Hey, don't worry. You don't have to do it by yourself. You're not alone. There's a lot of people in this problem, and there are a lot of people helping, and they're waiting to help you. Listed on the back of the brochure, I'm going to read a couple of them, are hotlines and websites that can help you find good health care, the treatment you need, and even a place to live if you need one. Call the toll-free number or visit the website of your choice today, and it could positively change your whole life. Now I'm going to put this up so you can see. You can pause it if you want to and see them. Count to 5. 1, 2, 3, 4, 5. Now I'll read them off because I like to do that. So SAMHSA's National Helpline, you can reach them at 1-800-662-HELP. We already heard that one, 1-800-662-4357. There's the National AIDS Hotline that you can get a hold of them at 1-800-342-AIDS, AIDS. That's 1-800-342-2437. And then en español is the Línea Directa Agencia Nacional de SIDA. That's 1-800-344-SIDA, SIDA. That's 1-800-344-7432. 1-800-344-7432. And we got the Gay Men's Health Crisis Hotline for the guys, and you can reach them at 1-800-AIDS-NYC. That's 1-800-AIDS-NYC or 1-800-243-7692. You can also visit the following websites. Substance Abuse Treatment Facility Locator. You find that at www.findtreatment.samhsa.gov or Centers for Disease Control and Prevention. That's at cdc.gov/HIV/default.html. That's a little longer there. You can get AIDS info at aidsinfo.nih.gov. That's aidsinfo.nih.gov. And then there's the Office of National AIDS Policy, which is at thewhitehouse.gov/administration/EOP/ONAP. And finally, the American Foundation for AIDS Research, which is amfar.org. Thank you for listening. We've been learning about drugs, alcohol, and HIV/AIDS, a consumer's guide. If you're consuming drugs and alcohol, you're consuming them, you're a consumer, so you might want to consider stopping that before you have a problem. But if you do have a problem with HIV/AIDS, we've given you some folks that you can reach out to, and they're going to help you get better. Thank you.